Hi, I'm Mike Coffman, and it's a pleasure to be with you today. There's no question that our nation's healthcare system is broken. Costs continue to skyrocket, and every day, more and more American families are losing their coverage or can no longer afford it. I agree with my colleagues that Congress needs to act and reform the current system. But creating a massive new government program to artificially compete with private industry is not the answer. Unfortunately, those on the other side have taken to blaming insurers as the keystone to healthcare reform. While insurers are an easy target, blaming them for all the problems is short-sighted and accomplishes nothing. They rail against bloated insurance company profits and blame our broken system on their greed. Yet, if you look at all the profits from every health insurer for the entire year, and you add in all the profits from the pharma companies for the entire year, you could cover every American for 7 days. Not exactly the answer to the current crisis, is it? It's time to move beyond focusing on insurers and tackle the really tough questions of cost of care and cost of the current proposals, something Washington continues to avoid. The President's plan will stick American families with more than a $1 trillion price tag, yet it won't improve our system and certainly won't reduce the cost of care. We need reforms that make health care more affordable for all Americans, and we must use market-based solutions to ensure real competition and choice. A government option will not bolster competition among insurers. That's simply a farce. So how do we lower costs and improve the status quo? It begins by focusing on rewarding better health outcomes over more procedures. We should be creating incentives that would encourage us to take better care of ourselves. We should be working to figure out how we more cost-effectively treat chronic conditions. Conditions such as diabetes and high blood pressure account for about 70% of all healthcare costs. Yet they often are manageable and preventable through simple lifestyle changes. My colleagues and I have proposed common sense solutions that attack the heart of the problem, cost. And you're going to hear me talk a lot about that today. Now, my goal is to get every American insured. But new government mandates that will force more than 100 million Americans to leave their current plan is not an acceptable solution to get there. The fact is 85% of Americans have health insurance, and the vast majority of them are happy with the coverage that they have. I'm not willing to put that in jeopardy. It is disingenuous for the other side to talk about healthcare reform without tackling frivolous medical lawsuits, which cost Americans billions of dollars every year. The other side simply refuses to take on the trial lawyers and include lawsuit abuse reform in their proposals. The plan I support would put an end to these abusive lawsuits. As long as doctors remain in fear of medical malpractice lawsuits, they will continue to practice defensive medicine. Doctors will continue overutilizing tests and conducting procedures that are unnecessary. If a patient needs one test, but the doctor orders 3 tests out of fear, that's 2 tests too many, and every American ends up paying for it. Another problem with the current plan moving through Congress is the mandated taxes on all small businesses, taxes which could result in the direct loss of nearly 5 million jobs. Congress should be creating jobs, not killing them to fund a government takeover of the healthcare industry. Specifically, I believe that we must enact reforms to ensure those with pre-existing conditions are able to obtain coverage. The most frustrating part of the current discussion for me is the other side's my way or the highway approach to passing reforms. By saying, my plan or nothing, the President has presented the American people with a false choice. My hope today is that we are not so polarized in Washington that those at this forum can't at least come together and agree on some bipartisan reforms that will directly benefit the people of Colorado. As this critical issue continues, I will personally keep fighting for common sense alternatives that ensure real competition and improve affordability of care and do not create new taxes. Thank you so much for listening.